Okay, continuing on with the musculoskeletal. We are now doing the knee. The knees. Can you see that? And here we're going to be looking at the knees. We're looking for any scarring. We're inspecting. And we are first going to start palpating the surfaces of the knee. And we'll start with the medial surfaces and the epicondyles surfaces of the knee. And then we will be feeling for the tibia and the fibula condyles. And we are going to want to frame the knee. And then we're going to go to the patella and we're going to feel the groove underneath the patella. And then the bone distal to the patella groove. So then that would be the tibial tuberosity. And if there was a large bump, then that we've seen, then if there's a large bump, that would be Osgood-Schlatters syndrome, and it would be pronounced large bump. And then we're going to go lateral to the meniscal groove and medial to the meniscal groove. And then the posterior aspect of the knee. So this would be behind there, and there would be a little groove under there at the fossa. And we're looking for a Baker's cyst. And sometimes the patient will complain of a ball, or they cannot squat, or they got some fluid buildup back there. And that's what you're looking for whenever you palpate behind the knee. And now we are going to have the patient do some extension. So like you're kicking a football, there you go. And do that for the other side. And then have you kick back towards your butt. And then we're going to have you do some abduction, which is away from the body. So I'm going to have you move your foot out. Or, let's see, sorry. While you're sitting there, move it out that way. Oh. And then that way. Good. And then some adduction. And they're going to have you bend it like that. And the other one. Yeah. So now, looks like we got to lay back down. To do some more tests. Well, we'll do the test lying down here in just a second. We're going to move on to the feet. Just while you're still sitting. So at the feet, we're just looking here. We are looking for any gout. We're looking for any for symmetry. We're looking at the toes. We're looking at the ankles. And then we're going to start palpating. And first we're going to do the lateral malleolus. And we'll do that for each side. So, which is the prominent bone. Prominent bone over here. And then the medial. So the medial and the labral malleolus aspect. And then we're going to go to the heel bone. And we're going to palpate that. And then we're going to palpate the metatarsals, the top of the foot. And we're going to palpate the toes and the dip joints of the toes and the sides of the foot and the arch. And then I'm going to have the patient do some flexion. So I'm going to have you flex towards the ceiling with your foot. And then I'm going to have you extend and try to touch your butt with it. There you go. And then we're going to do some eversion. So we're going to have you, yes, that way. And then inversion, correct. So the next portion of the exam, we'll have the patient lying down and we'll do the special test for the knees.